Okay, well, welcome everybody to our Speakers Bureau. Today we are going to talk about Patient Safety Week. And today we have with us Dr. Tracy Chamblee. So thanks so much for being here after all the technical difficulties. We're happy to see you.
No, thank you. I'm so excited to be here to talk about something that I'm very, very passionate about. So thank you.
We're excited to get into that conversation too. So just as some housekeeping before we get going, I'm sure as many of you know, there is a chat function in Zoom. So if you do have questions or comments throughout our discussion today, please feel free to put them in the chat. We will address them at the end of our discussion during a Q&A time. This session is also being recorded. So if you have to run off for a lunch meeting, that is okay. It'll be recorded, sent out, and also posted. So you can go back and get the information at a later time. So without further ado, let's get going. Do you want to tell us a little bit about your background and then why this topic is so important to you?
Of course, thank you. So just very quickly, I joined HSC, the SaferCare Texas, which was formerly called the Institute for Patient Safety. We're housed in the Center for Academic Innovation. I joined back in July, and so I'm still learning a lot about the university, about SaferCare Texas, getting to know colleagues, but I'm so excited to be here. I couldn't be happier about what we're doing and my role, which is the clinical executive for SaferCare Texas. And just a little bit about me, my background. I am a pediatric advanced practice nurse, a clinical nurse specialist. And my specialty area is the pediatric intensive care. I spent many years working in the ICU with kids of all ages. It's just a very special work environment for me. So most recently, before coming to HSC and to SaferCare Texas, I was in a senior leadership role at Children's Health in Dallas, where I was overseeing system level quality and safety. So for the main hospital, there were 2 smaller hospitals and all the ambulatory entities. So that was my role. I had a great team that supported me. I learned a lot. And so I'm bringing some of that passion for quality and safety here to this role in SaferCare Texas. So that's a little bit about me.
Yes, and we're happy to have you. And before we do go any further, I do want to address our kind of matching. I'm wearing some orange, you're wearing some
Yes.
orange. Do you want to speak about that?
Yeah, so we'll talk about that hopefully later on as well, but the World Health Organization, who really sponsors World Patient Safety Day, designated the color orange to signify the significance of safety in the workplace. And so, yes, there's going to be an ask later on for everyone who's listening to designate a day and ask your team members to wear orange to designate the importance of safety in the workplace.
Perfect. Well, I did dig out some orange, so I'm glad I found it. All right, well, let's jump right in. Will you explain to us what Patient Safety Day is all about?
Absolutely. So this is actually World Patient Safety. So I want to signify that or emphasize that it's World Patient Safety Day. So everyone who works in healthcare across the globe has information and should be celebrating, recognizing, talking about the significance of safety in the workplace today, but really every day. So last year, the World Health Organization came together and in recognition that safety, patient safety, is a global issue, they established World Patient Safety Day to be an annual event. And so here we are today talking about this issue. So there are 3 broad objectives that were established related to World Patient Safety Day. And those things are to increase public awareness and engagement, to enhance our global understanding, so everyone across the globe is on the same page when it comes to safety, and then also just to spur some solidarity and action to promote safety in the workplace within the healthcare environment. And so the other thing I want to mention is that this day is firmly grounded in that fundamental principle of medicine, which is to first do no harm.
Amazing. So will you tell us more about this year's theme?
Absolutely. So the theme that was selected for this year's celebration is healthcare worker safety. And I think it's very timely given the pandemic that we are all living through these days. So the slogan is safe healthcare workers, safe patients. And like I said, it's very timely. In fact, this pandemic has really exacerbated the challenges and risks that healthcare workers face across the globe when they're on the job. Issues like healthcare associated infections. Today, bringing COVID home, acquiring it myself or bringing it home to a family member is a real issue that people are facing each and every day on the job. Other issues like violence, stigma, psychological and emotional disturbances, and even illness or death. All of these things contribute to burnout. And so there's always been the issue of burnout in many professions, but healthcare in particular. But now we're hearing more and more, and there's unprecedented numbers of healthcare workers who are burning out, so to speak. And so it's a huge issue. So stress, it exists in our everyday lives. There's good stress and there's bad stress. But working in a stressful environment contributes to error. This is well documented in the literature. In the healthcare setting, when this happens, these errors can end up reaching a patient or even a team member and result in harm. And in healthcare, we have a long history of being a stressful work environment. I've been in healthcare for over 30 years, and I've experienced it firsthand. I also want to just talk a little bit about we're human. We're all human, and we are integral to healthcare. But because we're human, we're fallible. And because we're fallible, we make mistakes. We will make mistakes, all of us. But when you compound that with working in a stressful environment, it just increases the likelihood that mistakes or errors will happen. And these errors, as I said, can reach a patient or even a team member and result in harm.
Mm-hmm.
So this is why psychological and physical safety are so important. And one of the things I'm very proud to share about World Patient Safety Day is that in addition to the theme focusing on healthcare worker safety, they also have issued a call to action. The WHO, the World Health Organization, issued a call to action. Speak up for healthcare worker safety is that call to action. And so here today, one of my challenges to everyone who's listening is to be empowered by this, to heed this call, empower yourself, and go back and empower your colleagues to speak up, to let someone know if you don't feel safe in your work environment.
I think that's a great statement there. And I think the overarching memo is we need to take care of those who take care of us. And so not only did you mention physical safety, but you mentioned psychological safety. So can you explain a little bit more on that?
Yes, absolutely. So quite simply, when you think about psychological safety in the workplace, it really is the belief that you won't be punished when you make a mistake. And yes, I said when you make a mistake.
Mm-hmm.
Once again, we're all humans, we're fallible, and we all make mistakes. And so the very first step is simply acknowledging I'm human, I'm fallible, I'm going to make a mistake. And so creating that safety that that's okay, that I'm not going to be punished, like I said, is the first step to getting to psychological safety.
Mm-hmm. So with that, is there a way to make sure that you continue down that road? Because I feel like that's a beginning place. But while you're in the workplace and you have that thought of, okay, well, if I do make a mistake, I'm not going to get in trouble. I'm not always worried about that. How can I continue that growth?
So I think a lot of this I look at leaders and how the organizational leaders set the tone for creating that culture that it's okay, that even if mistakes are made, we're going to investigate, we're going to get down to what was the root cause of the issue. And then if the cause of the issue was a process or system, then we're going to improve that process or system. If the root cause was a slip or a lapse, a mistake, then we're going to comfort that person that made a mistake. And that, all of that is the root or the foundation of a just or fair culture. Yeah. And so implementing or having that just or fair culture contributes to psychological safety. And there are some other things, again, that I want to talk about individually that people can do, but also leaders can do to create that psychological safety.
Yeah, perfect. Well, thank you for that. So I want to backtrack a little bit. We're talking about World Patient Safety Day. So what is patient safety? Can you share about that?
Absolutely. So when you think about patient safety, it really is a relatively young discipline that emerged on the heels of a report from the Institute of Medicine. And that report is called To Err is Human. That report came out in 1999, and in it was a report that anywhere from 44 to 98,000 deaths a year in our country were attributed to medical error or adverse events. When that publication came out, it really set our industry on its ear. This movement was really, in the beginning, focused on care in the hospital. But now, 20 years later, we recognize that harm occurs in all healthcare settings. And we also know that most of the harm that's associated with adverse events is preventable. So since that publication came out, I'm really happy to share we have made great strides in patient safety, and I really want to just call it safety in the United States. But we still have many, many, many opportunities to improve. And the focus of patient safety is now moving into other healthcare settings like ambulatory care or primary care. And this is the new frontier of patient safety. So let me just share a little bit of data. I won't get too embroiled in the data, but I think it's important.
Yes, please do.
In the hospital setting, every year, more than 130 million adverse events occur. And so on the one hand, I want to say this is awesome that we have great reporting, that team members feel empowered to report, because how else are we going to know what events are happening and what are our opportunities for improvement? But on the other hand, these adverse events are directly related to unsafe care. And when we dig into them, when we do investigations and peel away those layers, what we almost always find out is that there is a flawed process or a flawed system that contributed to or directly caused this error. So a trade secret from the world of quality is there is no such thing as a perfect system or a perfect process. Perfection in this realm simply doesn't exist. So as organizations, healthcare organizations, it's really our job every single day to be looking for problems. What is the next thing that's going to fail? What is the next thing that's going to go wrong? So leaders on their units or departments, that's what we should be doing each and every day, finding and fixing those problems. So I'm getting on my soapbox.
No, it's okay.
Another piece of data. As much as 15% of hospital expenses can be attributed to treating these process or system failures that result in failing to keep our patients safe or patient harm. So that's significant. And then in the ambulatory setting, as many as 4 out of 10 patients experience some level of harm, and almost always that harm is preventable. And then one more piece, and I'll stop my soapbox, but In the literature, it's reported in our country, in the United States, that medical errors are considered the third leading cause of death at 440,000 per year. That's right behind heart disease and cancer. And so when you think of it that way, that's pretty powerful, and it puts things in perspective.
Mhm.
So for SaferCare Texas, our mission is to eliminate preventable harm. And we do this through education, through advocacy, and by challenging traditional thinking as it relates to quality and safety in any healthcare setting.
And that makes total sense. And I do also want to say, you go on any soapbox you want. That's why you're here. You're the expert here. So in hearing you talk, though, it does seem that it's like a trickle-down effect. There has to be healthcare worker safety to have patient safety. So can you explain how that is or isn't true?
Absolutely. And you're absolutely right. So for me, the most simplistic answer is, if those people who work on the front lines, whether physicians, nurses, physical therapists, respiratory therapists, PCTs, medical assistants, whomever those folks are, all those frontline professional workers, if they don't feel safe in their work environment, how can we expect them to keep patients safe? And then if we want to kind of peel it away another layer, let's talk about safety. Like, what do we even mean? What is the definition of safety? For me, in this journey of patient safety that I've been on for the past at least 10 to 15 years, the best definition that I have found is safety is a dynamic non-event. And so just think about that for a moment. Safety is not static. Safety is something that we have to constantly keep our eye on. And again, it requires that continuous learning, continuously looking for what's the next opportunity to fail. So in order to keep everyone safe, a culture that's focused on safety in the workplace is really needed. And it's the responsibility of organizational leaders to set the tone and to role model that everyone's safe is the priority.
I couldn't agree more. That's absolutely true. So you said that culture of safety, though. So one, what is that? What does it look like? And how does somebody foster that?
Right, great. So what we're really talking about is organizational culture. And so when you look in the literature, there's lots of definitions of organizational culture, but for me, the most clear definition is how we operate or how we function every day at work, even when no one's looking. Yep. That's the best definition of organizational culture. And so a culture that prioritizes safety, we get to the culture of safety. A culture of safety is focused on the psychological safety that we spoke about, where team members feel empowered to report when things go wrong or something's just not right. But at the same time, those team members also trust that when they report, they'll be treated justly or fairly. In addition to that, those team members need to trust that when they report something, someone's going to follow up on it. And then that person is going to report back how that issue was resolved. And so that, in essence, is closed loop communication. Because it's great if we report, but if there's no follow-up and then no follow through and feedback, over time, why am I going to report? If nothing's going to happen, nothing's going to get better, why should I even report it? So it's not just the reporting. The reporting is the first step, but the following up, following through, and feedback, closed loop communication is huge for a culture of safety.
Absolutely. And it seems to me like safety, whether you're talking about healthcare or patient, it comes from being proactive and then also being reactive and learning from the mistakes. So not to be a downer, but do you have any examples of healthcare worker safety issues that maybe we've learned from?
So unfortunately, there's a pretty long list of healthcare worker safety issues. And yes, I will highlight some recent issues, but also talk about some of those long-standing issues. And I'll start with the pandemic. This ongoing experience that healthcare workers are living through during the pandemic is a great example. And the first one that I'm going to start with is the lack of personal protective equipment, or
Yes.
PPE. And I know everyone who's listening, we've heard it so many times in the news. There's professional organizations are coming out and in support of making sure that anybody who is on the front line has the gear that they need to protect themselves.
Right.
So that's a huge issue. And just put yourself there and imagine going to work day in and day out, working in an environment where you don't feel safe. It's a real issue, and it's impacting healthcare workers every day. And it leads to mental health issues like depression, anxiety, even suicide. So it's our job, leaders' jobs, to empower healthcare workers to speak up and voice their concerns about the conditions that they're working in. And then just this morning, prior to coming here, I was on another virtual learning conference, and one of the speakers spoke about resiliency in the context of this same issue. And some of the issues that she pointed out that have come to light that healthcare workers are dealing with during the pandemic are fear of taking COVID home to their family members, fear of their own death or the death of a loved one related to COVID, financial issues, childcare issues, the issue of homeschooling if you have children that are school age, just overarching guilt. And then the issue of moral injury that impacts your relationship with your patient and sometimes your ability to provide care, the care that they need. And then that comes back to safety, that you're really not mentally or psychologically where you should be, and that can increase the risk of error. So it all becomes circular. And then there are other issues that predate COVID and our pandemic. And one of those very important issues that was a hot topic nationally prior to COVID that seems to have not be as spoken about as much, and that is workplace violence. And what I'm referring to here is physical assault from patients, from caregivers, or even team members when you're on the job. Things like verbal abuse, harassment, bullying. And so, yes, this exists in healthcare, and it happens a lot more frequently than you might think. It's not okay. It's not acceptable. Issues like this also contribute to mental health issues like depression, anxiety, suicide, burnout. So it just, again, more facts, more data. Across the globe, an estimated 264 million people suffer from depression. It's one of the leading causes of disability. And many people who suffer depression also suffer symptoms of anxiety. Mental health issues like these have a significant impact economically on the work environment because of lost productivity. And when you think about a cost associated with that, globally, that cost is estimated to be somewhere in the $1 trillion per year range. And importantly, in many cases, these issues are preventable. So once again, this is why a culture that's focused on safety is so important.
Yes, and I heard you just again bring up that psychological safety of the worker. And we touched on this earlier, but I do want to give you a time to expand on it. So what can we do to create that psychological safety?
So thank you for circling back around. This is a really important topic, and it's one that we could probably talk the entire 30 minutes or so on. And we're seeing more and more information come out virtually in the literature, et cetera, about psychological safety. But what I want to focus on for our time here is the Institute for Healthcare Improvement. They recently launched a campaign on psychological safety, and they call it Your Psychological PPE, or Your Psychological Personal Protective Equipment. And so in this campaign, they offer strategies to promote mental health and well-being. And these strategies are targeted at individuals, but also at leaders. And so I want to give just a couple of examples for each category. So for individuals, a couple of things that are recommended to create your own psychological PPE are, it sounds so simple, but prioritizing taking time off to create that space between your work life and your personal life. And that sounds so simple, but it resonates with me, and I think everyone who works in healthcare, that we're so committed to our job. I think that term, it may be an antiquated term, but the workaholic, I said alcoholic, but I meant workaholic.
Okay.
We're all workaholics. Like, we want to be there. We want to do the best job that we can do. And so creating that space is sometimes challenging, but it needs to be a priority to create that space, and encouraging and empowering people that it's okay. It's okay to do that. We need you to do that. Take care of yourself so that you can come back and take care of our patients.
Yeah.
The second individual strategy, really, it's very timely for the pandemic, is encouraging team members to be open to seeking their own help, counseling, mental health support, etc. Again, something that I think is difficult or challenging for many of us who work in healthcare to do, but just being there to support and encourage doing that. And then the last example I'll share for individuals is, it's kind of flipping the script a little bit, looking at it from a different perspective, and that is, when you have an opportunity, show gratitude in the workplace. Something as simple as that can do an awful lot to create that well-being and promote mental health. So those are just some quick examples that the IHI is offering for individuals.
Well,
And then shifting over,
sorry.
I'm sorry, go ahead.
I was gonna say thank you for sharing that, because to me this seems like it should be common knowledge, but clearly it's not. So I'm glad we're getting to talk about it.
And so just a few things for leaders, and I'll just highlight, like I said, 2 or 3 of them. But for leaders, what can leaders do to promote psychological safety in the workplace? And so same thing, the first one that I want to share seems simple, but when you think about it, it's really important. And the first example is to make sure that everyone in your work environment is clear about their role and their responsibilities. Don't assume it. Make sure everyone knows, and that they also know who their leader is. There are many informal leaders that lead on a given day, or that we ask to lead in a given day. Charge nurse is an example. So make sure that every person who's on the shift knows who is their go-to person for the day. Again, don't just make assumptions. Ensure that everyone knows. Things like daily huddles can remedy that and make sure that everyone's on the same page. The second example is cultivating that environment that encourages peer support. So the relationship of team members, making sure that they're there, that they support each other, that they have each other's back on any given day. Just cultivating that type of environment can contribute to mental health, but also well-being for all team members. And then the last example that I'll share here is, as a leader, if you're not familiar, educate yourself on what the signs and symptoms of distress, of burnout are in team members, and then be on the lookout, constantly evaluate and assess. And when you see those signs and symptoms, intervene so that you can prevent it. And so if any of you are interested in more information on this and the IHI's campaign, just simply go to the IHI website and search for psychological PPE.
Perfect. Yeah. And I think in 2020, especially, this is something we definitely need to pay attention to, because this pandemic, I think it's worn everybody out, whether you're a healthcare provider or not, but
Right.
absolutely our healthcare workers. So it's of utmost importance right now. So we did talk about the color orange earlier, but is there anything else that has to do with World Patient Safety Day that you'd want to touch on?
Yes. So I have a couple of things. First, I think I said it in the beginning, but I'll say it again. But as I'm empowering everyone. When you go back to your workplace, talk to your leaders about this topic of safety in the workplace.
Mm-hmm.
Or if you are a leader, empower your teams to speak up about any concerns that they have. This is really how we start cultivating a culture of safety. And if you're a leader, when someone reports an issue to you, follow up on it.
Mm-hmm.
Report back what was done to address it. This is the starting place. As I said, there's a lot more, but this is just a great place to start. And then I'll say it again about the color orange. Between now and the end of this month, the World Health Organization is really asking each of us to pick a day. It doesn't have to be today. Today is the day that we're celebrating, but pick a day and ask your team members to wear orange. Tell them why. And the why is to recognize the significance of safety in the work environment. The World Health Organization is also pushing out a much more visible display by asking organizations across the world to light up a building or a monument or some structure outside with an orange light to show and recognize the importance of safety every day, every patient. So if you're listening to the news, be on the lookout. It could be local, national, world news. Hopefully there will be some recognition of that that's reported so we can see the actual displays. And then I think the last thing that I would ask is get on social media. Let us know how you speak up for healthcare worker safety. Use the hashtag World Patient Safety Day and then tag at SaferCare Texas or mention us in your posts and use our hashtag SaferCare Texas. So let's talk about it on social media.
Yes. Social media is the biggest platform we have right now, so might as well use it. So I do have a follow-up question to that. So if people are going to tag you on their Instagram post or Facebook, are y'all going to post it somewhere? Are you going to share it? If I would assume you want to see a large collection of these. So where will they go?
So, I hadn't gotten that far yet, but
Okay.
yes, if people will tag us, I'll follow up with Katie Shanklin, who's our PR, and we will definitely do something to promote and feedback everyone, feedback to those who do. So I don't have a specific or a great answer for that, but we will do something. If you respond, if you tag us, we will make it known.
Perfect. That's all we want to hear. We're starting the ball rolling right now.
Okay, great.
So before I ask my last question for you, I want to ask the room, if you have any questions right now or any comments or anything you want to talk about, put it in the chat and then we'll address it at the end. So my last question for you, do you have any closing thoughts about maybe just the day in general or the importance of the topic as a whole that you'd like to say in closing?
So for me, first, I just want to thank everyone for the opportunity to talk about this topic. This time has gone by very quickly. It's an important issue, something that I'm very passionate about, and I'm really just thankful for the opportunity to be able to have a platform. But it ultimately goes back to culture, organizational culture, changing the culture to one, as you've heard me say, that's focused on safety. And that really is a journey. It doesn't happen in a day or a week. It takes years.
Mm-hmm.
But really, more importantly, it requires constant focus and commitment from those at the top. our organizational leaders. And so once again, I'm empowering everyone to speak up and be a spark for change in your work environment.
I think that's a great thing to end on, but it does kind of lead into a question we got. So
Yeah.
a question from the audience says, what do you think will be the focus of patient safety in the coming years? Maybe what have we learned from COVID?
So I definitely think there's going to be a lot, and we're already starting to see it come out in the literature, either through professional associations or whatever the case may be, published literature, et cetera. For me, I truly believe that what I said in the very beginning, that patient safety is really shifting and focusing on areas that it hadn't focused on before, and that is the ambulatory environment, primary care, which is really where care is shifting to in general, and this started prior to COVID. But I really think that's where patient safety is going. More and more, that's what I'm seeing.
Well, great. Thank you so much. We don't have any other questions at the moment, but if anybody does have questions, you can send them to me or Dr. Chamblee, if you're okay with that. I'm sure people would love to reach
absolutely.
out to you. Remember to post those photos, tag SaferCare Texas, wear your orange, encourage others to do so.
Yes.
But from the University of North Texas Health Science Center, we thank everybody for being here, but then Dr. Chamblee, thank you for your time today and talking on such an important topic in this day that we need to recognize and pay more attention to every other day of the year as well. So
yes, every day.
Absolutely. But thanks so much for being here. Again, this session is recorded and there was lots of great information, so you can go back and rewatch it and take some notes. But for us, that is going to be it. So thanks so much. Have a great rest of your day.